Good morning, and a warm welcome to the University of the West Indies Cayfield campus here in sunny Barbados. First, I want to extend greetings from the Professor, the Most Honorable V. Udine Barato, our PBC and principal here at the Cayfield campus, who sends her apologies and the apologies from the executive management team who are involved in a council meeting this morning and could not be physically with us. But I want to welcome those of you who are physically with us, from the members of the campus community, members of the private sector, the public sector, who are able to be with us here in the Cayfield School of Business at the Cayfield campus. We also want to welcome those of you joining us on our streams, both on Facebook Live and YouTube, who will be with us for the session. Warm welcome to members of the media as well, and of course the team who put this together for us this morning. As you will see, we do have our panelists here, and thank you for consenting to be with us this morning, and we're looking forward to an engaging and rich discussion on our topic. This seminar, dual mode, is entitled Workplace Health and Wellness, Open for Business During COVID-19. And it's the latest seminar brought to you through the Center for Professional Development and Lifelong Learning. I am Sonia Mahan and will be your moderator for this morning's event. Just some protocols. Please note that I'm going to invite the panelists as they begin speaking, all distance, social distance and physical distances being observed, to remove their masks, but we're asking those of you in the audience to remain masked for the event. When we get to the Q&A session, you'll notice that there are mics available for you to ask your questions or make your comments. Please feel free to do so. You are free to remove your mask, and Dr. Connell will talk about that later on during his presentation, but please don't touch the mic stand. If you prefer, there is a number that we're going to be circulating that you can send your message, your comments or your questions through WhatsApp. And I'll be receiving them right here at the podium. Since 1948, the World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Later, they expanded this to include a definition of a healthy workplace, and I'm going to beg your indulgence to just see what that definition says. A healthy workplace is one in which workers and managers collaborate to use a continual improvement process to protect and promote the health, safety, and well-being of workers and the sustainability of the workplace by considering the following, based on identified needs: health and safety concerns in the physical work environment, health, safety, and well-being concerns in the psychosocial work environment, including organization of work and workplace culture, personal health resources in the workplace, and ways of participating in the community to improve the health of workers, their families, and other members of the community. The ILO also weighed in on this, and they speak of workplace well-being as being related to all aspects of working life, from the quality and safety of the physical environment to how workers feel about their work, their working environment, the climate at work, and the work organization. Many studies have reinforced this. Why should organizations care, whether you're in the private sector or the public sector, to show that workers' health and well-being is actually a key factor in determining an organization's long-term effectiveness and success. And many studies, as I said before, show a direct link between productivity levels and the general health and well-being of the workforce. As we in Barbados and the region watched the news of a new virus emerging out of Wuhan, China, none of us, I think, or very few of us, anticipated the impact this would have on us personally, socially, professionally, and even on educational institutions. None of us envisaged in December 2019 that we would be having a discussion like this 6 to 7 months later. It was only, and I'm going to cast your mind back, it was only in February that the World Health Organization actually named this beyond the novel virus, the novel coronavirus. And it was therefore on February 11th that we heard the official name emerging, coronavirus 2, SARS-CoV-2, and then on that same day, the WHO announced a name that the rest of us laymen would be able to pronounce and to write about, the COVID-19, as the name of this new disease. WHO named this a month later a pandemic, previously referred to as just a global health emergency. So by March 11th, we were talking about a global pandemic. Those of us in the region, and I know for me personally here in Barbados, we were still watching this as a far-off phenomenon, watching it move across. So March 17th, and I remember being in my office in a meeting when the government announced the first 2 cases of and you would hear this adjective often, the dreaded COVID-19 actually reaching the shores of Barbados. And I think for many of us, that's when, I know for me personally, that's when reality struck. Before, it was something distant. Even though it was coming, it was something distant. Suddenly, it was here. First came the phases of the anticipated shutdowns. The government had done a fantastic job of preparing us. But there's a difference between preparation and then it being real. So we went through the phases of the shutdown. We went through the phases of being home during the shutdown. And now we're in the phases of re-emerging and being back to the new normal. We're hearing that phrase over and over again. So this morning's conversation, I was about to say fireside chat, is really about reopening in the age of COVID-19. This is not going away soon, but we do have to get back to normal. And how do we do that in the age of COVID-19? And today we have assembled an expert panel that will be discussing many of these issues, and let me briefly introduce them to you. And then I'm going to hand over the conversation to get them started about the key topics under this theme. First, we have Dr. Heather Herewood. Dr. Herewood is a medical doctor and lecturer in public health and epidemiology, and head of the public health group in the Faculty of Medical Sciences here at UWI Cayfield campus. In addition to research interests in health systems, from a practitioner perspective, Dr. Harewood has worked and continues to work with the Ministry of Health in Barbados as a medical officer of health from 2002 to 2015, and was involved in planning and implementation of the public health resources response to SARS, H1N1, and Ebola. And I say currently because I know, Heather, you are involved still at that level. She's a member of the UWI COVID-19 Public Health Group, the COVID-19 Health and Safety Protocols Committee, and the Government of Barbados's COVID-19 Health Advocates Team. Good morning, Heather, and welcome.
Thank you.
Dr. Connell, Dr. Kenneth Connell, is a full-time faculty member in the Faculty of Medical Sciences, again, here at the Cayfield campus. He's an internist, a clinical pharmacologist, and is chairman of the Cayfield campus's Health and Wellness Committee. He's also a consultant physician at the Queen Elizabeth Hospital here in Barbados. He's governor of the American College of Physicians, Caribbean chapter, and is the chairman of the Barbados Drug Formulary Committee. He has done extensive work with the U.S. Center for Disease Control and Prevention, the CDC, with blood pressure control programs, and currently sits on the World Health Organization's Hypertension Treatment Guidelines Developing Group, the GDG, which is an easier way to pronounce. Okay. He's a member of the National COVID-19 Core Health Advocates Team, acronym CHAT, again, easier to pronounce, which is a group of national experts advising the government on the COVID-19 response. His professional recognitions include being a fellow of the American College of Physicians, fellow of the Royal College of Physicians, UK, and fellowship of the American College of Cardiology. Good morning, Dr. Connell.
Good morning.
Welcome.
It's a pleasure being here.
And I must say that Dr. Connell has been the fulcrum for pulling everybody together today, so thank you for your efforts.
You're welcome.
Mrs. Sheena Mears Granville. Good morning, Sheena. On September 1st, 2017, Mrs. Sheena Mears Granville joined the Barbados Employers Confederation as Executive Director, and I'm pausing for the next part, as the first female to hold this position. Sheena has over 15 years of experience in human resources and industrial relations, and her passion for people development is pursued through teaching in the Executive Diploma Program right here at the Cayfield School of Business and Management. She also sits on the board of the Technical, Vocational, and Educational Training Council of Barbados. Most of us would know that as, in the island would know that as TVET. She's heavily involved in the management and negotiation of collective labor agreements, and her diverse portfolio of projects includes conducting labor market research, serving as editor of labor publications, chairing tripartite committees, preparing guidance on various labor issues, and leading organizational development initiatives. Sheena holds a master's in labor and employment relations, a BSc in management, and a level 4 Caribbean vocational qualification, CVQ, in training and assessment. Again, good morning, and thank you for being here, Sheena. Good morning. And last but not least, Dr. Jacqueline Benn. Dr. Benn is a product of, and yes, I had to say this, Benn is a product of the Christchurch Foundation School here in Barbados and the Combermere Secondary School, also here in Barbados, and has been working as a clinical psychologist, I gave the plug, since 2004. Prior to entering the field of clinical psychology, she worked for several years as a registered general nurse and registered psychiatric nurse at the Queen Elizabeth Hospital here in Barbados. She was also trained as an intensive care nurse and spent half her nursing life in the critical care units. She was part of the medical and nursing team that pioneered the coronary artery bypass surgery, better known as the open heart surgery, in Barbados in 1994. In 2003, she completed her clinical psychology program at the UWI Ramona campus, gaining an MSc with distinction, following which she moved to the Psychiatric Hospital here in Barbados to work as a clinical psychologist, spending 10 years there. In 2014, we welcomed her here to the University of the West Indies Cayfield campus, where she currently serves as a psychological counselor in the Office of Student Services. She has taught across several of our programs, both at the undergraduate and postgraduate level, and with the UWI Open Campus as well. Deeply interested in students and others becoming the best that they can be, and she does this by mentoring students, young people, and others, as well as fulfilling her role as psychological counselor. Thank you, Dr. Benn, for being here this morning as well. So as you see, we've assembled a team of panelists, each going to give their perspectives from their own viewpoint on the impact of COVID-19. And without much further ado, Dr. Connell, I'm looking squarely at you because we are going to kick off the discussion with the question that is the focal point of why we are here. Let's talk about the impact that COVID-19 has had on the workplace and the workforce. And I'm going to then ask each of the panelists to give your point of view there after you give us just a brief opening remark. So that will be the order this morning. So you're going to give each your opening remarks, and then we're going to dive off into that question, which is why we're here this morning. Okay.
So thank you so much, Sonia, and it's always great to be first up at the creases, especially since I failed miserably at cricket. So first, let me say it is a pleasure for me to be here with you in the Cayfield campus live face-to-face audience, and this may very well be the first face-to-face activity we've had since the official lockdown, but more importantly for you joining us online, whether you're on Facebook or all the various platforms for this important conversation. I am going to speak to you wearing another hat, and that is really as chair of the Campus Health and Wellness Committee, simply because it situates this discussion squarely where I think we would gain most from it. So we are now re-entering a new health landscape. Whether we choose to admit it or not, the world pre-COVID will never be here again. This is not all negative, and we kind of always look at changes. We're changing and we're adjusting to live with this disaster because a pandemic is in our midst. Let me just pause and state that there are two ways of addressing this, and we have kind of responded to one of them already. There is the emergency response. How do you deal with a pandemic that you know nothing about? What measures do you put in place? How do you educate the public? How does the health system prepare for this? And how do businesses respond to this as well? The second more important part of it, because it has longevity, is how do we change our health and wellness philosophy? And this philosophical change is more important for us and our survival going forward post-COVID. There are three main areas that I propose might bring about a philosophical change. One is infrastructural change. We have to redesign our offices, for instance, so that our desks are no longer right next to each other. We have to also kind of adjust how we do business so that the entire team isn't at work and in the office at the same time. But there's much more than just physical and infrastructural changes. There's also a behavioral change. How do we change the Caribbean culture of greeting people, where we hug each other if you haven't seen each other for a long time? This whole elbow knocking looks great and it looks cool. My students tell me I'm up at least 15 cool points. However, how do you kind of greet someone without even physically touching them by any means, you know, and is that the Caribbean culture? The third point is really set aside from us, not just our own individual behavior and the behavior of society. How does our government and institutions that create policies, how do they respond and change policies rapidly in response to this? The one thing COVID has taught us as a society is we have to be agile. A lack of agility has really placed several countries at risk. And without this agility moving forward, where we can quickly adjust, we are likely to succumb, unfortunately, to another pandemic.
Thank you for those opening remarks, Dr. Connell. We look forward again to engaging further as the webinar and the seminar continues. Dr. Herewood, if I can have your opening remarks.
Yes, thank you very much, Sonia. And it's also a pleasure for me to be here. And to just, piggyback on some of the things that Kenneth shared with us this morning, why are we here? And I like to use the word pragmatic. We're here for some very pragmatic reasons. Me, from the public health point of view, of course, health is, as was aptly described, not just the absence of disease, but we're looking at health from a holistic point of view. And it's to really try to get this whole concept of wellness and how do we not just come to work, but how do we thrive and how do we do our best and be our best selves, even in an environment that has been changed because of COVID-19. So it has altered the way in which we do business and probably has altered it forever from our perspective in the Caribbean. We think about how we greet each other, but how we work, we do a lot of verbal and touching and, we congregate by the coffee machine, for example. We have a little chat. So these are some of the things that we have to think differently about as well. But also from a mental health point of view, how do we now feel about treating people differently or people treating us differently because we may or may not be ill? So these are some of the things we have to speak about, and I know Sheena will probably speak more to this, but it's also for the other pragmatic reason, so psychosocial health, but also economic reasons. Our economy is a part of our health as well. When we worry about our next meal, about how do we pay bills, that affects our health generally as well. So we want to look at all of these spheres of health today. And also recognizing that the workplace is a good place to start to have practices because it impacts on when we go back to home. Are we bringing things from home or are we taking things from work to home? And good practices that start at work can also be taken into the home. So, we can look at it as a positive way. And I think these are some of the things we want to explore today to see how we can make our workplaces, and I use the term, a supportive environment for us to practice wellness in the age of COVID. So these are the sort of things that I would like to focus on and to really push and re-emphasize the things that we may not want to do, but we have to do in the public health interventions. The things that, we're not accustomed to, but we have been quite good based on some surveys that have been done in the island and being done in the region in terms of hand washing and mask wearing. So how do we make it better and consistent? Because I think consistency and correctness are the 2 C's that I want to emphasize today also for the public health interventions. So thank you.
Thank you, Heather. And Sheena, from the BEC point of view.
So first of all, let me thank you for inviting me to this morning session. I do believe that we're going to have a very engaging and interesting discussion. So I look forward to hearing the questions and the comments from those who are joining us in person and virtually as well. Like Dr. Connell said, this is, I believe, my first face-to-face setting in a very long time. So I even thought today might have been virtual. So we're getting accustomed to that new normal. But I have some information that I want to share with you as we talk about being open for business in this new landscape that we have to deal with. So at the end of June, the International Labour Organization published some statistics, and they indicated that there has been a 14% drop in global working hours. 14% might not sound like a lot. However, that is the equivalent to 400 million full-time jobs lost because of the pandemic. That is a staggering number, but that is worldwide. When they looked at a regional perspective, the Americas, our region, was actually trending higher. So while the worldwide average was 14%, regionally in the Americas, the job loss was about 18.3%. Those numbers are really high. Now, while we don't have statistics on Barbados, what we also know, just give you general information, women have also been disproportionately affected by the pandemic. This is because of their overrepresentation in some economic sectors. So we tend to see more women in accommodation, food, sales, those types of industries which were especially hard hit by the pandemic. And we tend to see a lot more women in care work. Once again, domestic work, especially heavily impacted by the pandemic. So to just give you a perspective of some Barbadian reality, early in the crisis, so about April, coming on to the end of April, we at the BC would have done a survey on the impact that COVID-19 was having on the business community. And we did that survey to get some information to know what was happening out there with businesses. And at that point, about 40% of Barbadian enterprises had stopped operating. Now, I don't expect that number to be 40% right now because we've had reopening, etc. However, when you have 40% of your businesses closed for 6 weeks, you're going to have a knock-on economic effect, right? And we also noted that we had a few businesses which would have indicated that they had to either lay off or make persons permanently redundant. So we had about 35% of enterprises indicating that they had to use redundancy or layoff, some measure of having persons not work during the period. And there were only, I think, about 10% who were able to remain fully operational during our lockdown period. So we've had a big blow to our economy from COVID-19. Some of the key issues that businesses have faced and continue to face would be cash flow to maintain their operations. So about 70% indicated at that time that they did not have enough cash flow or there were cash flow concerns to maintain business continuity. 70% of our businesses said that they did not have cash flow or those reserves were inadequate to maintain their businesses. That is a very high number. So we're talking about a business context where we have disruption to supply chains. I think I've heard a lot on social media about persons not receiving packages on time, etc., and that's personal. But we've had supply chain interruptions from businesses operating. And I know even in the health sector, trying to source medication, that type of thing, we're experiencing that. So I'm raising these points to let you know that the environment within which business now has to operate has completely changed. And so we have businesses who are trying to manage the stress of cash flow coupled with reduced sales. Reduced sales because we have a large percentage of our workforce who are still currently unemployed, whether that is permanent redundancy or whether they're on temporary layoff. And if we think about it, how many hotels are actually open? And we have a large number of persons who work in the tourism industry. So obviously that will have a spill-on effect on the economy and our operations. And additionally, the businesses that are open and they're operating, they're facing increased costs. So there's personnel at the doors doing the sanitization, doing the temperature checks, trying to follow the protocols. There's increased expenses in terms of sanitizing and maintaining hygiene, those types of things. And then there's still costs for PPE for your employees and trying to manage the health and safety within the workspace during this pandemic and to be a responsible employer. And employers still have to manage their vulnerable staff members as well as the vulnerable customers or clients that they have to deal with. So they still have elderly persons who are still going to institutions to conduct business. So they're trying to manage those people differently. I will put a plug here for, well, you're managing the elderly, because I know that one is a red flag. You still have to watch for persons who have young children with them. So you might have a mother with a newborn baby who still has to transact business. So some special accommodation for them as well. So at this point, we keep saying the new normal, but I think we're trying to craft that new normal, craft a way in which businesses can operate, but they're still trying to remain viable in a very difficult circumstance. And I heard someone say at a meeting that while we can have drugs for or medication to treat diseases, we still have to make sure that we don't have the disease of hunger. So we still need to have our economy going in order to provide jobs so persons can earn a livelihood. So I just wanted to lay that context in terms of the business environment within which we now find ourselves having to operate, and to ensure that we are operating in a very safe and in a healthy way, because that is important for our nation.
Thank you so much, Sheena. And rounding out the opening remarks, Dr. Benn, this is not on purpose, but I'll ask you to give your opening remarks.
Thank you so much, Sonia. I am happy to be here because it gives me the opportunity to make another plug for the importance of mental health in Barbados and generally. Years ago, when I was first introduced to health care, that was back in the 80s, I was taught that man is a biopsychosocial spiritual being. And this COVID-19 pandemic has certainly demonstrated that. So the World Health Organization states that mental health is an essential and indispensable feature of health since life. And they continue by stating that mental health is a state of well-being where one recognizes one's own abilities, you can manage the normal pressures of life, and you can work effectively and contribute to your community. They continue to say that mental health is fundamental to our collective and individual ability as humans to think, emote, meaning to feel, interact with each other, earn a living, as Sheena has said, and enjoy life. So on this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern of individuals, communities, and societies throughout the world. So what we are saying and what we are recognizing is that COVID has really upended how we have been living. It has had very detrimental effects on our physical health, on our economic health, and all of those then play a part in our mental health. If we are unable to work, if we are ill, all of those things affect how we think about ourselves and how we're able to function or not function. And work is an integral aspect of our lives. Again, the World Health Organization in 2012 in a report stated that they asked about why health, safety, and well-being at work. Well, we've begun to recognize the importance of that. Workers form half of the population. A healthy workforce is a prerequisite for sustainable development and social well-being. So if we have a pandemic which affects us physically and which affects us severely from a mental health perspective, what are the risks at stake? Workers, loss of health and well-being. The organization or the company within which these workers, are employed. There's a loss of productivity and profit. We talk a lot about productivity, but if we do not have mentally healthy workers, how can we expect our productivity levels to rise? Then within the community, there's a loss of solidarity and equity. And then, so what does that translate into for our country, Barbados, and generally for the world? They have indicated there's a loss of 4.5% of GDP where you have mentally unhealthy workers. So, I think that it is incumbent upon us to reinforce and to ensure that going forward, we recognize the importance or the role that mental health plays in our places of endeavor, not only with our workers, the persons who run the organizations, the managers, those in charge. Because remember, at the basic level, man is a biopsychosocial being. And if that is not working effectively, then we're going to be in trouble. Thank you.
Well, thank you all for those opening remarks. As you can see, we are going to be engaging in some of that more in depth now. So I'm going to throw out the question I asked originally, the reason why we're here, and I'm going to start again with Dr. Connell. What impact has COVID-19 had on our workforce, is having on our workplaces? And we've heard I've heard phrases, pandemic paralysis and workplace inertia. And I'm sure in the discussion, we may be able to expand more on what those terms are. So I'm going to start with Dr. Connell and then throw that question out to all of the panelists as well.
Sure. Thank you, Sonia. So I would describe COVID-19 almost as a health ecology stress test. It has really stressed and if you're familiar with how a stress test works, if you are a heart patient or cardiac patient and doctors are trying to determine the fitness of your cardiovascular system or how well your heart is working, they put you on the treadmill and they hook you up to some machines and then they look to see how the heart is behaving under stress. COVID has done just that. It has put the health landscape under stress. How we have responded has been developmental. Initially, there was shock. So when you first start to run on a treadmill, you're like, why is this thing moving? And why am I not stationary? What do I have to do to keep going? Then eventually you kind of get your pace and you experiment and say, well, let me incline it some more and see what happens. Like, let me reopen borders and see what happens, or close them again and then what happens. So it really has put us under stress. I mentioned initially that I think that the health philosophy has to change. And I left it there, but I want to kind of delve deeper into that. And I took what Heather said about building back better, because I think it's so important. If we emerge, when we emerge from COVID to a new state of normality, what factors would have changed that will have a positive longevity in the health landscape? And let me use some examples. How many of us in this room or in the audience, and in the audience, you are free to vote however you want. How many of us have had our flu vaccine last year? How many of us now, as a result of COVID-19, a flu virus will consider, I'm going to say consider, having our flu vaccine this year? How many of us, for instance, know when flu season even starts? And is it relevant to Barbados when flu season starts? As a tourist destination where people are coming in with annual flu viruses every year and we are vulnerable. Do we wear masks during flu season? Because wearing a mask during flu season stands out as you are weird. Why are you walking around with this thing on your face? I can tell you in Barbados, wearing a mask anywhere, including the bank, will never be considered weird again. So those are examples, concrete examples. Should we be touching each other as we normally would outside of flu season during the flu season? The answer is no. But if you say someone, I can't give you a hug at church because it's December and it's flu season, they're looking, okay, if you want to be that way, kind of. So what are the positive legacies that will come out of this? It's not all negative. Of course, the stress test was thrown upon us suddenly. We were suddenly moving from walking casually down the street to running on the treadmill and trying to keep pace. But there's some positive aspects that I think we can take away from this. The Cave Hill campus, just use this campus as an example. So we are in the business of delivering an educational product to students in a face-to-face manner. We're not meant to be interacting with students online and saying, raise your hand if you have a question. It's not authentic, right? We were forced into remote teaching. We had to. We couldn't say, well, I know there's a pandemic, but this isn't our contract with you, so come into the classroom, which might put you at an increased risk, because we want to have the face-to-face interaction. The strategy for an educational institution like Cave Hill Campus is now how do we deliver that educational product at a high degree of excellence whilst maintaining and respecting the boundaries of physical distancing and remote engagement. To make it even better, how can we kind of redesign our pedagogical structures such that our educational product is no longer completely face-to-face, but you know what? It's better. I say to the medical students that I interact with that I am slightly envious of their training in the age of a pandemic, because these are doctors in 2024 and 2025. When they emerge, who will be totally comfortable interacting with patients remotely? They would have mastered telemedicine and telehealth, hopefully, from this experience. They will not be as comfortable as I am of seeing a patient and not thinking about the risk of an infection, because that's how they were taught. They will never face a professional workplace where infectious disease is not at the forefront. And here's another closing point, and because I want to get Heather's view on this. Now, I mentioned we're on a stress test, and COVID is a stress test, but we haven't also been the most fit participant on the treadmill. We entered the treadmill, we got on the treadmill unhealthily, okay? We had our NCD burdens with hypertension, diabetes, all these things. So we struggled onto the treadmill, barely holding on. It was pressed on full speed, and then we saw, well, wait, hang on. This pandemic is knocking off people who are at very high risk. Why are we at high risk? Because of the social determinants of health in the Caribbean, and because hypertension is such a major driver for this. I have to say, I have never seen adherence in my patient population as I have in COVID. Everyone is taking their blood pressure medication. Some of them are trying to double up on it because they think it's double protection. But it's simply sending the message, look at what a pandemic can do to behavior. And I don't know what Heather thinks about the building back better. I mean, do you think as a health landscape we should just be aiming to get back where we were before?
Well, thanks, Kenneth, for that very complex question. Yes, building back better is important, but I think I have a slightly different view. We started off unhealthy from some points of view in the sense that, yes, there's a high NCD burden. But what I think was really important for us in Barbados and most of the Caribbean and in countries that did really well is to have a robust public health system. We can look across the world. We can compare countries that are doing well, some that are doing not so well. And a lot of it comes back to the ability to mobilize your population to understand what's happening. So you spoke about patients taking their medication very well, or maybe too well. And I think one of the public health strategies that worked for us was the risk communication, which is really speaking to people in a time of crisis, but giving them specific messages that help them to know what to do, when to do, and to bring it down to a very practical level so that they don't have to, figure out what is Dr. So-and-so saying to me or what does this mean. And also having this messaging coming out in more than one format. So some people love videos because they're visual learners. Some people need to hear the messaging, some people need to see it. And I think that, having that combined strategy really was important. And also having persons who were considered trustworthy by the population delivering these messages. Because if I'm saying to you, this is the status in Barbados, this is what the evidence is showing, this is what you ought to do. If you don't believe what I'm saying, then that is lost. So I think those are some of the strengths that actually came about from our public health system, and I think people are now recognizing the importance of public health. So yes, I have my bias as a public health physician, but I mean being realistic and looking across countries, we recognize countries that had a stronger public health system, a public health system that chose to have good leadership for the pandemic planning, for the, the laying out of the orders, for having that kind of collaborative thing. And if I go back to what public health is defined as, it is not the people who sit at the Ministry of Health. Public health is really the collective actions of society to promote health, to prevent disease, to preserve health, to do all the things that we're trying to do now. And I'm saying this because I think at the basic individual level, we would need to recognize that what we do as individuals is going to actually have a synergistic effect as to whether we succeed and build back better, or whether we continue to struggle with this, or if another pandemic, there's no wood, but not wood, another pandemic faces us. So I agree, we do have the NCD burden which we need to address. But I think also building back better will help us to put a bit more into the prevention, and also patients taking the responsibility for themselves. Where telemedicine is important too, because being able to converse and say, well, doctor, this is what's happening to me, or even to express disagreement, because sometimes our patients don't necessarily know how to say if they agree or disagree. So I think there's going to be new norms developing even in how patients and doctors communicate. And I think it's a positive thing, because I always do encourage patients, say what, write a list if you think you're not going to remember. If I say something that doesn't make sense, question it. You're entitled to another opinion. And I think that there's more information out there. And one of the other things that I think COVID has shown us, that there's an epidemic of misinformation. And I think one of the things that was handled well, again, within our setting, was to make sure the information was evidence-based and consistent and correct. So the C's are coming back again. But it is important because, giving wrong information and having people run with that information can actually undo all that public health. And the other, I'm talking about public health widely, so societies, all of us, is an all-of-society approach. So yes, it's a stress test. So yes, we may be floundering in some areas, but I think what we can do is build on our strengths and then look to build back better on the areas. So NCD management, getting patients more responsible for their care, because I think at the heart of it, that's what health promotion is about. Enabling people to feel that they have this self-efficacy and that they can manage better, and they can lobby to get the supportive environments that are required to make things better, because NCDs is, yes, take your medication, but the other things, what are the supportive things in policy? So, and also the mental health, but I will pass that back on to Jackie, because the mental health aspect, I think we've had some highs and lows, and we can look at that a bit more.
Yes.
Jackie, before you weigh in, I just want to remind the audience who is joining us digitally, you can weigh in at any time. Please post your comments in YouTube or Facebook Live. You'll see me looking down at my phone. I'm not taking calls. I'm actually looking at the communication coming off of those two platforms as well. So don't wait until our Q&A session. You're free to post your questions or comments as we continue on this morning. My apologies, Jackie. Over to you again.
Yes. So we've spoken a lot about NCDs, and I hasten to remind us all that mental health or mental disorder, mental illness, is an NCD. It's a non-communicable disease. And we tend not to put a lot of emphasis on mental health. I think because of the stigma, the fact that, how mental health has been perceived throughout history, and this statement that, which is false, that once, as and I'm using this word very advisedly, where people say once mad, always mad. That is not true, because if you're saying that, then you're saying that once hypertensive, always hypertensive, and that does not have to be so. So we have got on we begun the stress test, as Dr. Connell said, in an unhealthy state.
Yeah.
And that is again supported by what has happened with us from a mental health perspective. I think all of the manifestations that we have seen coming out of COVID in terms of the stressors that people have been trying to respond to, and the results of that, lots of anxiety, depression, maybe some type of adjustment disorder, those things have been as a result, or have, some of them have been built on what has been happening with us before in our work environments. So the UE COVID Task Force, they did a rapid response impact survey, which was carried out across all 5 of the campuses. This occurred between April and May 2020. And they surveyed 847 staff and 276 persons who were also students, but they were also staff members. And they looked at a variety of factors. They look at the campus, faculty age, gender, sexual orientation, depression, anxiety, a number of factors. And this indicated that 24% of staff reported moderately severe to severe depressive symptoms, and 22% reported severe anxiety symptoms on clinical screening measures. So what does that suggest? That suggests that the severity of those symptoms warrant some type of clinical intervention. And I dare say that will be repeated across the many organizations. I don't think that would be, just for the UE campuses. Yeah. So that suggests to us that we have to pay a lot of attention going forward to how we promote mental health, what are the structures that we are going to put into place to ensure that our employees, our managers, that everybody who goes to work has the ability to access mental health care, that it plays a part, that it is not a sidebar, that it is an integral part of your working environment. So, when you go, you have your appraisal done. Maybe that can also be a part can be played in terms of how are you functioning, how are you feeling in terms of your environment. Not to be used against you, but to help the organization to be the best organization that it can be. But I will talk a little later about how employers can do some more to ensure that their working environment, that their workplaces work towards enhancing the mental health and well-being of their workers. So that leads into Sheena.
The whole impact, I know you would have gone through some of the statistics that you would have done through the surveys and so on. But what are we seeing now in terms of the impact now that we're reopening?
So I just want to comment on what my fellow panelists would have shared. In terms of the public health advice that has been circulating, I think that information was very useful. You're quite correct. I did not know that. I did not know how to wash my hands before. And as the information started circulating, I was like, okay, I've been doing this wrong all of these years, right? And when you mentioned the fact that we were put on this stress test, you gave that analogy. And, sitting over here and thinking from a business perspective now, I agree. We got on that stress test. We got on that treadmill already
Exhausted.
behind the curve. Exhausted. Because think about it. We only just entered an IMF program to shore up our economy. So we're under the BERT program, Barbados Economic Recovery and Transformation Plan. So we had some economic challenges that we were working through. I'm glad that this hit after we started the process. So we were in a better position to try to start moving from a walk to a jog on that treadmill. But what the businesses have been forced to do is to be very agile. And someone mentioned agility in their opening comments. Being agile and being called to pivot quickly to respond to the emergency orders and what businesses could and could not do when it came to reopening, the new protocols that you had to implement so that you could open, but then having to quickly move into remote work to stay operational. And then looking at redefining your office space and your layout so that you can have physical distancing within the office space. For example, we at the BEC, our office is physically open, but we're doing a split between in-office and remote work so that we can maintain that physical distance among the team members. So businesses have been called to respond very quickly. So you've had to move from getting on that treadmill, from a walk to a jog, and for many persons it's a full-on sprint as they just try to stay ahead and keep viable. So from a business perspective, the questions are emerging. How do you now find out what your customers want and deliver that in a way that is safe to do so? And that is now calling for persons to pause and start thinking how non-traditionally. See, it's easy to say, well, we're just going to reopen and operate as per usual, but the environment is not necessarily one that's conducive to that. Yeah. So how do you start to think about creative ways of delivering your product and your service so you can remain viable and do that in a safe manner that your customers also want to maintain? So we see the rise of delivery services that never existed before. Persons have unleashed online shopping that they didn't have before in that quick pivot and turnaround to remain viable. I just want to also support you in terms of that call for the mental health support. What I have heard from some HR practitioners, the feedback is that they're seeing or they have seen an increase in the use of their employee assistance programs. So persons have been tapping in where it's available, because persons are expressing that they're under severe stress. Persons who might have, through contact tracing, being contacted even though they might have tested negative, just the entire experience sometimes is very traumatic for them and they need some assistance in dealing with that. So we are within the workspace, those issues are coming to the fore as well in terms of persons needing that support for their mental health. So we have persons trying to manage the stress of dealing with the business reality, but then they also might be having their own mental health challenges, because besides business, there's family, and then there's still your workers who are looking towards you for some guidance in this uncharted territory. So managing that entire space. So those are some of the issues that we're having to deal with.
Yeah, I listened to your presentation, Sheena. I really enjoyed it, and I noted that you were very polite as the only non-healthcare person on the stage, but I want to be provocative, and despite being on campus, we're always polite. So the Prime Minister mentioned there's a balance between life and livelihood. We can't keep our borders closed forever because we may be protecting life from COVID, but our livelihood is lost because of tourism is our major industry. And at the very beginning of this pandemic, I got the sense that it was a battle between health and business. And the small business sector were pushing and saying, why are you guys putting all these unreasonable health policies in place? Not using you as an example, of course. We need to open. We need to open quickly. We need to get things back to normal because businesses are dying. One popular or possibly now unpopular political leader is still pushing that in his country. And it's with massive consequences. Can you honestly say, representing the business sector, that business has been totally comfortable with all of these policies?
What I can say is there is the recognition from the business community that protocols are necessary. There is that recognition. And the business community has advocated that we need to open, but we need to open in a safe manner. Now, will there be agreement on every protocol? Let's face it, not necessarily. But the platform that we build upon has been that Barbados needs to open, but it needs to open in a safe manner. And why that is crucial, the business community does not believe we can afford a second shutdown. So therefore, let's open in a safe manner to ensure we don't get back to a shutdown phase. So I would say that that's the general consensus of the business community.
From a health perspective, though, would you be happy, Heather, I reckon, would you be happy, though, if we had to? Do you think the business community would be happy with a second shutdown? Well, not happy.
Right. I don't think that's the right adjective you want.
Would they really want to adhere to it? In other words, are we at a state where we're saying, well, regardless of what happens with COVID, we don't want a second shutdown?
Now, when we say the business community, I need to break that down because I think sometimes people have a sense when we talk about the business community, we're talking about large conglomerates. Remember, when we talk about the business community, in Barbados and in many of the Caribbean countries, we have a large percentage of small and micro enterprises. So we have persons in the beauty industry that might be a solo entrepreneur. When we shut down, those people have no source of income, none. Now, there was an amendment, the Prime Minister did make the announcement that persons who were paying international insurance, they would get a grant, a business continuity grant, but that would have come midstream. So at the onset, when we went into a shutdown, those persons had no income. And then they are also suffering from reduced income now that we've reopened.
Of course.
So we still have to place that in context. So I'm not saying that those persons, that the business community is saying, regardless of what happens, we need to remain open. But some persons found themselves in some very vulnerable situations. So let's not think only banks and insurance companies and supermarkets, but we do have a large network of very small and micro enterprises who were severely impacted. And even the larger ones, there's something I learned very early on in this pandemic, was that word pandemic was a problem for businesses because it nullified their business interruption insurance.
Of course.
So very often we think, but they have business interruption insurance, so they'll weather the storm. But once the pandemic was declared by the WHO, it nullified that. And that was beyond the insurance industry in Barbados didn't have control over that. There's no reinsurance for that. So that's something that was built into the policy. So, I mean, there's a context within which we have to speak. So, as I said, they're very keen that we reopen, but reopen safely because we don't want to get to the stage where we have to go into another shutdown. So the idea is let's do everything to make sure we never get back to that stage.
Before Heather intercedes here, we do have a question coming through. What are the basic minimums? I'm a small business. What are the basic minimum protocols that I should be considering for me and two staff members? What should I be thinking of?
Do you want?
They didn't identify the industry.
Okay, well, I can start, and obviously everybody else can pitch in. I think first of all, if you think about the health of yourself or your employees. First of all, if you're not well, so the general advice we give to persons, if you're not well, you shouldn't be working. And I mean, this is important even for a self-employed person, because we think about, as Sheena says, you're leaving home to go into the workplace. But your workplace may be your salon next door or your business.
Yeah.
So that also does have implications that you're not expected to turn up to work or to offer service if you're not feeling well. But let's assume that people are well. What do we want persons to do at a minimum in a workplace is to think about the basic, what we call non-pharmaceutical interventions. And I just want to emphasize that these are described in some parts of the literature as old-time public health measures, but they're very important because unlike the flu, where there's a vaccine or Tamiflu or other things, there is no proven pharmacological intervention at this point. I mean, there's some promising results coming from the trials of vaccines, but at this point, there's no proven intervention. So the non-pharmaceutical interventions are the mainstay, and they still need to be practiced even if a vaccine becomes available. And I want to say that,
definitely.
and say that, and say that, because we still have to wash our hands properly. So the things we have to do, maintain the physical distancing. I mean, we did away with the term social distancing because we recognize the social isolation was a big problem. So the physical distancing, I mean, you know, so recommendations would say 3 to 6 feet. We started with 6 feet. And it's in relation to the fact that if we cough, sneeze, if we talk, if we have a good lung capacity, you know, droplets from our noses or mouths can go as far as 3 feet, or for some people beyond that. So the 6 foot distance was brought in as a literal physical measure to allow droplets to hit the ground and not to get onto, you know, our eyes, our noses, our mouths, where we have the, you know, the pink colored skin, the mucous membranes. That's where the virus enters our body. Which brings me to the next point. So we speak about face coverings. Because, you know, if we sneeze, laugh, cough, we also want to retain those. So face coverings actually does serve a secondary, as a secondary barrier. Respiratory etiquette. So all these words that we never really used before, except in public health classes. But, you know, if you cough or if you sneeze, you should cover your cough and sneezes. And it's ironic that we teach that to small children, but as we get older as adults, we fall away from those practices. So to part of the building back better and to, you know, answer the question, at a minimum, we need to remember that respiratory etiquette applies to all ages, and it has to be done correctly and consistently. So, you know, you don't sneeze and do this. You have to either catch it in a tissue or the crook of your arm. And if you sneeze into tissue, dispose of the tissue. So kerchiefs are no-no. And then once you've done that, you need to clean your hands. So hand hygiene is the other thing. So the physical distancing, respiratory hygiene, wearing a face covering, and I'm not using the term mask because masks really should be more for the medical type masks, so face covering, but hand hygiene is very important. So Sheena said, and I think many people recognize that we don't wash our hands properly.
Or as often.
Or as often as we ought to, so hand washing should be done often. And it should be done ideally with liquid soap and water, especially in a communal environment, because bar soap is a haven for bacteria. So liquid soap, it does not have to be antibacterial soap because it has another knock-on effect with, with antibiotic resistance. So we really want you to just use simple liquid soap. Cover, you know, ensure that all the surfaces are washed. And what can be done, even in a small workplace, you can just put up signage. I mean, there's, you know, WHO, CDC, because I think just looking and following what the, you know, you're not thinking about it, but you're actually doing it correctly. You get all the surfaces washed. Alcohol-based sanitizers are also important. They should be at least 60% alcohol. But also remember, if your hands are visibly dirty, they're not going to work. So they're not the catch-all for everything. They have to be appropriate. So if your hands are visibly dirty, you do better to get a wet wipe, clean off that, and then sanitize your hands. So those are some of the basic things that persons need to do. So if you're not well, don't go to work. Seek medical attention. Because, I mean, there are other things that might cause a fever, but the reality is, or might cause your symptoms, but you need to be clear what's happening. Apply the physical distancing, hand washing, face covering, and avoid touching your eyes, your nose, and your mouth, which is often very hard. So even with masks, the last thing I'm going to say about masks, don't touch the front of the mask, because that's the part of the mask that's contaminated or dirty. So use elastic ties to make any adjustments. And, you know, avoid pulling it down to speak, because you're now pulling it onto an area that's potentially contaminated. So then when you pull it back up onto your face, you're now putting it in the area of your nose and mouth, which you're trying to protect in the first place. So it's better to just remove the mask to speak. So those are some of the basic things.
I think
And
that comment on mask is so important, though,
Yeah.
because you see that quite often. People
Yeah.
just pull the mask down to speak. They've moved all the infection that's all under here. It's a perfect location,
Yes.
then they slip it back up.
Yes.
But Heather,
I want to jump in.
Sure, go ahead.
Sorry to cross you, but we at the Barbados Employers Confederation would have created a COVID page on our website. So for businesses who are looking for more information, they
right.
can go to barbadosemployers.com, and we have a COVID tab, which has a lot of information that helps in terms of policies, etc., that they can find useful for reference.
Because my final point was going to refer to the GIS
Yes,
webpage as well,
and they
which
have the
speaks to
protocols
specific businesses as well.
for the different industries as
Yes.
well.
I
So
think
there's
what's so
some
important
information
for
out there.
business, though, in terms of what are the policies that you need to implement, is that your business has to have a policy. You can't just kind of play this by ear, or you have to be
No.
very clear whether you are the salon owner or the CEO of a banking institution. What is the policy for this place? What are we going to allow? What are we not going to allow based on what the national policy is? And one thing I think businesses have been challenged with, and just to add to what Heather was saying, is how do you deal with the high-risk employee that's kind of causing you challenges, because you now have a statement by the highest office in the land saying, well, if you are high risk, it is preference for you to work from at home. Can your business afford for your employees to work from at home, all of them? So just to back up on how COVID affects high-risk employees, we started by saying this is a person going on a treadmill that probably wasn't the healthiest before, who is exhausted. And I'm not speaking to one person, but as a population, because of our NCD burden, we were not the healthiest people going on the treadmill. What COVID has done, interestingly, is it's a viral infection that causes an acute viral illness. Many of us, most of us, believe it or not, we survive the viral illness. That's not a problem at all. The problem is what the virus has cleverly done. It has tricked the immune system or the defense system to almost create this tsunami of an attack that is exaggerated. And in the medical fraternity, we look in amazement to see how patients are literally mounting an attack against their own body just for a virus that really was a minor infection. And how do you deal with that is the problem. If you are high risk, of course, you are now mounting an attack against your heart, your kidneys, your lungs, everywhere. And if you have an NCD prior to that, like hypertension or diabetes, these organs are not at the healthiest before. Well, we see COVID-19 as a lung disease. Really what's causing the death is really the cardiovascular complications, which is where the cardiovascular risk factors like hypertension, diabetes, obesity, these are the main drivers. How does business deal with that? Well, so most countries around the world have issued this kind of guidelines about high-risk patients, and the Barbados Ministry of Health and Wellness has issued statements about assessment by medical professionals about who is high risk. I know that there have been a lot of things going around, including some of my colleagues writing to businesses and saying, this person is high risk, almost ... manage as you see fit. It's not a very clear directive to businesses, and it must be irritating to receive a note like that. How I manage it, since almost 100% of my patients have hypertension, so they all can come and say, I'm here for my sick leave. And they're often shocked when I say, well, let's assess your risk. In other words, what is your level of control? What is your level of adherence? Not in the last week when you were taking all the medication since you heard about this pandemic coming, but what was your level of adherence before? What was your level of adherence in monitoring your blood pressure at home? Based on that discussion, I then determine what the risk of the individual is, and also whether they're at home with another high-risk individual, like someone at home post-chemotherapy, because their risk is not really just their individual risk, but their environmental risk as well at home. Then I'll say, okay, well, it seems like you are high risk. And they'll say, yes, I get some time off from work. So I think that what your employer should consider doing is what measures can be put in place at work, because I'm not going to recommend that you stay home, such that you can attend work, but we can mitigate your risk. Such as maybe you might need to be in an individual office. Maybe you might have to wear the surgical mask as opposed to cloth covering because of your risk. Or maybe you might have to have shorter working hours at work, but not at home. And this is the conversation we have to have. We cannot afford as as a medical fraternity to automatically determine because someone has an NCD and they are at a higher risk, that automatically means work from home. That is not the case. It is also bad medicine, because what we're saying, and I know some of my patients who will probably watch this and saying, oh, I was going to make an appointment to see him to get some time off. But even if you have hypertension, that in itself does not make you automatically stay home. It means that you have to consider controlling your blood pressure more carefully. You have to consider doing all of the additional measures, because you don't want to get COVID to put yourself on the treadmill, that stress test, but it doesn't automatically mean that you should be working at home. And I think that employers kind of have that responsibility as well. Don't just accept the note, well, you know, I have sugar, so I can't come into work ever. I mean, that's not going to work. You have to say to your employees, you need to have a risk assessment and challenge, and this is going to be very controversial now, employers have to challenge the healthcare fraternity, not just the individual doctor now, the healthcare fraternity, to give clear, reasonable instructions on how they might mitigate the risk for that employer at work. And it cannot be just work from home.
Well, I am very glad that that statement came from you, Dr. Connell, saying that the medical fraternity should be challenged, and it didn't come from someone who's external to that community, because what you described are some real challenges that employers have had to deal with. In an effort to try to protect workers, employers are trying to find that balance, because every job is not a job that can be performed remotely. And therefore, I mean, if an entire organization has gone to remote work, that's simple. They're all working from home, so that take cares of everyone. But if you have a cashier, if you have a bank teller, those are customer-facing jobs that can't be performed remotely. And if you have persons working in those types of jobs, then employers have had to try to find ways of how can we deal with this employee. And a note saying, well, this person has diabetes or this person has hypertension doesn't give the employer much information to work with. So we've had employers who are trying to do their best, but with lack of information. And in some respects, they've had pushback from medical fraternity.
Right.
Persons would want to know, where are you asking for all of this information, that type of thing. But sometimes employers just want to make an informed decision on what do I do with this employee. And they're not medical experts. So they have to lean on the medical experts to provide them with the information so they can make the best decision possible with the information that they have.
Sure.
Right.
And I have 3 questions
Oh, wow.
coming straight to you, Dr. Benn, Jacqueline. The last 3 questions that came in all have to do around mental health of the employees and so on. So and all different variations. It's like a diamond with different facets, all 3. So the first that came in was, how does somebody who has lost their job or their businesses have collapsed or their business has collapsed get access to mental health or mental care? So that's one. Noting that one?
Yeah.
Number 2 was and this came off of our YouTube stream. In order to reduce the stigma, what would you advise in order to reduce the stigma of mental health issues? And can you give an idea of what the formal mental health support in a workplace could look like in light of the pandemic, but not only because of the pandemic? And then our third question, I'm just pulling up here, for persons within the workplace who are coming in the workplace, again, what supports formally should businesses provide that persons can access that support? I think it's easier for us to see the physical support that an employee might need. And when we're talking about employees, we're not talking just operational employee now. We're talking right up the chain, from the person at the operational level right through the strategic level within the organization.
All right.
So like I said, over to you.
Good. Thank you. We've spoken about balance, and that is another integral factor that we speak to in health. homeostasis, balance. That is important. So while we want to, or we are going back out to work, we have to balance the demands of economics with the demands of health. We do know that if we ensure that health is addressed, then it is highly likely that our economic picture will improve. So I want to point out that to ensure that we understand how we're working. We're not kind of fighting, we want to achieve that balance. Our bodies work towards that homeostasis. As far as businesses and the persons that they interface with, medical personnel and others, communication is another integral part of that play. Business managers, those in charge, have to communicate effectively and frequently with their employees so that everybody understands what is going on, how do I play my part, how is the organization going to assist me in us reaching the goal, which is working effectively and producing. Now, as far as the specific questions were concerned, loss of job and how do you access mental health care generally. That is a hard one in terms of people losing their jobs. As we've said before, a loss of a person losing his or her job, that is going to have a negative effect on their mental health because work is an important aspect of our lives. For those persons who have the wherewithal, they can seek private mental health care in the form of seeing a psychiatrist, psychologist. But for persons who would have lost their job, we still do have public mental health care available. That is available through the public health system. There are mental health clinics in most of the polyclinics. Now, it is not necessary you're going to be able to have an appointment or be able to see somebody every day because there's a team that has to go from clinic to clinic. And it is not available 24 hours of the day in those spaces, but there's still that help available. And so I am hoping that as we build back better, that we can address that so that we can have mental health care available just like how we have physical health care available. So the Psychiatric Hospital, I know we don't like to call that name, but I've worked there for 10 years, and I can say to you that they deliver good mental health care. They are available, there's an assessment unit that is available 24 hours a day, and that is like the accident and emergency for the QEH. So if you can walk off the road, if you're in a crisis, go to that facility and receive the care that you need.
And if I may, Jackie, there are also some resources available on the JS website as well.
Right.
Because even within religious groups, so the Muslim Association, they have groups as well. Because as you would want to emphasize that sometimes the counseling that you receive also has to be culturally, spiritually specific as well. So there are actually some other groups that are available, and those are listed on the JS website.
Yes.
So that's another resource that people can think about as well.
Right.
And with 10 more minutes to go, I just have one. Thank you, Dr. Benn.
The other question.
One.
Yes, we have one more question that this one came in twice
Okay.
about the physical protocols. And then I'm going to ask each of you to give a 2-minute wrap up as well. So you still have time to give your final thoughts. Gloves. So for anybody coming into the building this morning, and for many of our businesses, you would have been temperature checked. You would have been sprayed with some alcohol-based sanitizer. The question on the 2 questions came in, what about gloves? Should we be gloved as well? And what is the efficacy of wearing face shields? Or should I be in a face shield as well as a mask? Can I just wear a face shield instead of a mask? Those final thoughts, and then I will give you your 2 minutes.
Right.
So this is a quick one. Dr.
Okay.
Connell or whoever is taking that from the panel.
So it's an easy answer as well. The answer is no to both. So wearing gloves, no. Unless you are involved in an activity that you would normally wear gloves for.
Exactly.
So for instance, if you're examining a patient in my area, or if you are involved on campus in some other area where gloves would normally be expected to be worn, you would wear your gloves, but not as a preventive barrier for COVID-19. And even if you wear gloves, you're going to wash your hands after. One of the problems with wearing gloves, and this is why we don't recommend it, is that people somehow think that there is an antiviral substance that comes off of the glove that covers their hands indefinitely, so that even when they take them off, they don't wash. And I observed this at one of the hospitals that I work at, and I often see work colleagues who sometimes may remove gloves, and they may just move on to the next patient. And that is not how infection control works. You have to wash your hands. Your gloves really stop those kind of physical particles, but you have to wash your hands. Now, interestingly, the face shields...
Before you go to the face shields,
Sure.
if I may, and also for gloves, they need to be taken off correctly as well,
Yeah.
because otherwise you just, spread those viruses, germs into the air as well. So we actually do advise. We've advised some groups who've approached us. There's signage available again, CDC various websites, because this is dirty. So you need to touch all the dirty surfaces need to touch each other, not to put your dirty, contaminated hands under the glove.
Yeah.
So there's there's steps for taking off the glove.
And there's a video.
And there are videos, so
Yeah.
I'm just reminding persons, wear your gloves where they are appropriate. So we'll be back to C and C. Correct. It has to be the correct indication for the glove.
Right.
Has to be taken off correctly, and then the hand washing, as you were saying, because that
Absolutely.
is the ultimate thing. Hand washing goes across whatever intervention you're going to use.
Yeah, and somehow the whole thing about touching the surface translates into, oh, I now have COVID because I touched the COVID surface. That's not how it works. That might work for some viruses, but COVID has to enter your respiratory system.
Yes.
The only way that can happen is if you then touch your face or your eyes, your mouth, those kind of
And
things.
the nose, yeah.
The face shields, just quickly, they look cool, but the evidence for face shields is really for larger droplet particles and as an additional barrier, to the face covering or face mask.
So not in place.
So it's not in place of. I know it looks like a nice, cool gadget. You look kind of Star Trek-like when you're wearing them, but there is a risk, however, of wearing them by themselves, and that is because there's a possibility of still aerosol spreading because there's no seal really. There's no fit around your face. So that's generated. We now have an interesting situation with COVID where the airborne transmission is being investigated by scientists and the relevance. Now, I'm not going to state that a virus that has shown evidence of airborne transmission necessarily translates into it is infectious via the airborne route. There are two different things. So you might have a virus that can be that is airborne, but it's not infectious via the airborne route. And so the primary form of infection for COVID-19 is still droplets. It's still droplets. So direct answer, no. If you want to wear your face shield, just to look cool, make sure that you have a face covering under it. And if you're going to wear gloves, it should only be worn in circumstances where you would ordinarily wear them. Wash your hands after.
Well, thank you very much, panelists. We are now going, believe it or not, the time has gone, so we are down to your final remarks. And if you don't mind, I'm going to start with Sheena and then work my way around to Dr. Connell, to Kenneth.
Sure. I'll just close off by saying that businesses in Barbados have had to become very creative in responding to the crisis and in repositioning their companies through digital transformation. And while we know that the digital revolution was occurring, some persons have been dragged kicking and screaming a lot faster than they anticipated. However, I do believe that we have some built-in resilience and that we as a people are creative and we will find those creative responses. And we will do so in a way that is safe and is healthy for us to continue to have economic viability, but also to provide livelihoods to our workers, to our Barbadians, so that they can also earn a livelihood in a safe and effective way. So we'll continue as a business community to partner with the health community and the other social services to ensure that we as Barbadians, as Barbados, can progress in such a way that we all have a safe Barbados to live in.
Very well said.
Thank you.
Right.
Jackie?
So I'll use these last moments to answer the remaining questions. In order to reduce the stigma of mental health, we have to treat mental health as we do any other health area, and through education. Formal support for mental health at work, I think the time has come for us to implement, to encourage organizations to implement EAP or employee assistance programs within their organizations so that their employees can access that health care. I also want to say that they can facilitate mental health first aid training as well as psychological first aid training so that if something like this here should happen again or some other disaster, that you have persons on the ground who can help to facilitate the beginning of mental health care before you may have to hand it over to more professional individuals. So let us treat mental health care as though it is an integral aspect of our lives. Thank you.
Okay. Yeah, so my final words from the public health perspective is to say that we will continue to, look at the evidence, gather evidence that's relevant for Barbados, the region, and to feed that back into the various areas because, as Sheena said, the partnership with health is important and we need to give good evidence base. And that's something that is going to continue. But also, I just want to reach out to our audience here and those who are joining us via Facebook and YouTube to reemphasize what I said before, that it is the combined actions of society. So all of us are important players. We can't do it alone by making policies because policies have to be implemented and they have to be practiced appropriately. So I just want to encourage us to see that we are all part of the solution to making Barbados healthy again, making this economically viable again by adhering to the guidance that's given, making our livelihoods flourishing again, but also looking to build back better so that we're better prepared for what we don't know what's around the corner. So we just need to build on what we're doing so we can be more resilient and we can bounce back. Over to Kenneth.
Sure, thank you. So I would just close by saying that Barbados is perfectly situated to lead on this at an international scale. We have done so based on our COVID response. We were able to stop the treadmill and just close our borders, and we saw what happened in terms of the public health mitigation measures. The Ministry of Health and Wellness for Barbados should be acknowledged for the efforts that they've played. But the general public of Barbados should be the ones congratulated because we were the people not saying, oh, this is all fake news, I'm going to do as I please. Or, we were the ones who really implemented the public health policies and to lead. My vision for Barbados moving forward in a society where we now must live with COVID is how will we be innovative in our response to this pandemic so that we can now mitigate constantly, open, close, whatever must occur. How will we address the patient on the treadmill? How will we tackle our NCD burden, our mental health issues, all those kind of things so that we are now fitter in the event that the treadmill is again pushed on high speed, we can be a more resilient runner. And I'm pleased that Dr. Greenwich is in the audience here because the CPDLL will be hosting a course on this, so you can hear all of the presenters much more in depth. And it comes back to the point I was making about business having a structure and a policy. Your policy should be that all of your employees are trained in workplace health and wellness. It shouldn't be just I watched a webinar and I have an idea. You want to be trained in it. I'm pleased that a university is going to host that training.
Right, and that should be coming up later on this year, and we'll be sending information out through BEC and through all the various organizations that deal with business on the island. And indeed, it's going to be an online course coming up. I think we're doing it, Dr. Greenidge, acknowledging that you are here, the head of the Department of Management Studies, and indeed the host of this event as the person with responsibility on the campus for the Center for Professional Development and Lifelong Learning, what we call CPDLL. And this should be coming off before the end of the year.
August.
August, right around the corner, so look out for that, and you should be seeing some information streaming online at the end of this seminar, and for those who are joining us online, the webinar as well. And therefore, sadly, we already were here chatting for 90 minutes, believe it or not, and I just want to very, very quickly thank first and foremost the campus principal, Professor Barato, for allowing us to have our first physical public event on the campus, and thanking you, the members of the audience, for joining us this morning as we were talking about, and I know we had just mentioned it, the whole idea of workplace inertia and pandemic paralysis. The fact that you are physically here is a step in the direction that we're coming back to normal. So thank you for taking the time out to join us this morning. I want to thank our panelists for working so hard to bring this together, Dr. Connell, Dr. Herewood, Dr. Benn, and Sheena from BEC, and this would not have been possible without you. Every one of you presented the topic from your particular point of view, but this just shows the integration again between the university, the various disciplines and specialties, and our community, because that's our purpose. We are not here for ourselves. We serve the communities in which we exist.
Yes.
And not only, you just talked about digital transformation, the fact that we can leverage the digital technologies to give access to those who could not be physically here with us at CHSB this morning to still engage with us. And it's a continuing conversation. Again, the course is coming off, but you would have also seen the email addresses that are available, the email addresses and other contact information. So if you do have other questions or comments and so on, please feel free. This does not end the discussion. You can send those in at any time. And then finally, just want to give thanks to the management of CHSB, Cave School of Business and Management, for hosting us physically here this morning. The members of staff for our in-place unit, that's where our Department of Maintenance is, for arranging the set and allowing us to be here. The staff of the CPDLL, who worked tirelessly to get this pulled together so that we could bring it to you here this morning. Marcom also, who was instrumental in getting the word out and being able to have us beamed to you or filmed this morning, and the staff, of course, of UETV, through whose channels we are able to beam or stream the live event on those digital channels. And before we wrap up, I just want to give an acknowledgement to Dr. Dion Greenidge. We did mention his name before, for having the vision to allow us to give back to the community. This is the 6th webinar/seminar that we have offered through CPDLL, really engaging the general public and various organizations as you developed new norms, as you get exposed to new information, and to retool, as Sheena would have talked about. We do have a shifting and transitioning in the workforce, and many of the topics that we would have covered over the last 8 weeks would have at least, exposed persons to different areas that you may not have thought about to develop professionally. So I wanted to just acknowledge that you're here and thanking you for the vision and driving all of us towards that realization. So with that said, again, a warm welcome from Cave Hill, a warm goodbye from Cave Hill, and we look forward to engaging with you more in the near future. Thank you, and thank you all.